This video will give you key information about smooth recovery from hemorrhoid or pile surgery. Piles or hemorrhoids are abnormal blood vessels which ultimately form small lumps and then protrude outside. Hemorrhoids typically cause bleeding, pain, itching, and discomfort. Surgical treatment involves removal of. With this background now, let's see what we can do before surgery, during surgery, after surgery to improve symptoms. Before surgery, it's important that you do your research about your condition. And if your symptoms meet the requirements, then you find the right team and the surgeon, someone you can connect with, someone you can trust, and someone you can fall back on if things don't go to plan. 2 to 3 days before your surgery is a crucial period because this will determine the kind of stool that you will produce, the poo or the poop that is going to come out over here that you can control at this point. It is important that your stool is soft, and that will be determined by your diet, and also you may use stool softeners. It is imperative that your diet is light and has fiber to allow easy passage of the first stool motion, which can be quite painful. During surgery, it is now down to your surgeon to use surgical techniques that are known to cause less pain and ease recovery. That the tissue is handled carefully and the amount of damage kept to the minimum. There are now longer acting versions of local anesthetics, the effects of which can last for a few days. One of these is called lysosomal bupivacaine. Typically, the effects of local anesthetic wear off after a few hours, and that is when the discomfort starts. Use of longer acting versions may help this process. Immediately after surgery, patients are expected to have a little bit of bleeding, discomfort, and discharge. And it's typical that surgeons would have put a sanitary pad over the anal area, as well as putting packing at the site of the surgery. Excessive bleeding soon after surgery ought to be reported immediately to the surgical team. Patients should be able to void or pass urine within 8 hours of an operation. It is also possible and common to have spasm in the muscle that regulates urination. However, good pain relief and patience may pay dividends, and patients may be able to pass urine. Less commonly, a catheter is required. Patients may be able to relax the sphincter if they sit in a warm bath, take painkillers and relaxants, muscle relaxants such as Valium, and it is okay to urinate in the bath, just so to avoid any future complications. One of the most important strategies for control of pain is use of medication. And there are two important groups: those that use opioids, such as codeine and morphine. But the main problem with these medications is they cause constipation, which can be very troublesome in the immediate aftermath of surgery. And the others are non-steroidal anti-inflammatory tablets such as ibuprofen, paracetamol, diclofenac, and ketorolac. Except paracetamol, the others can cause gastric irritation, and if taken over a very long period of time, may be damaging to other organs. Diazepam or Valium is of value specifically in reducing the spasm. Spasm is the involuntary contraction of these muscles called the internal anal sphincter, drawn over here, and that is a normal body reaction to any injury. The muscles just contract, ending up in severe pain, not just over here but also in the pelvic muscles in the area. And lastly, the use of anesthetic creams and other creams that reduce swelling, especially after taking a bath, also called a Sitz Bath. Your surgical team will give you a prescription which will include a combination of these 4 groups, and it is important that this is taken as prescribed. Regulating the bowel motion after surgery is a crucial part of recovery. Over here, especially in the first 2 to 3 days, it is important that the diet is such that is commensurate with soft stool and that the volume isn't huge to allow easy passage through the anal canal and the area where surgery has occurred. It is also very important that patients take regular laxatives as prescribed, especially stool softeners, which take 2 to 3 days to take effect. Hence, it is best to start them before surgery. And keeping the anal area clean is hugely important. Dry tissue should not be used. Wet wipes and followed by a Sitz Bath is very beneficial in reducing pain and spasm. and I'll tell you a little bit more about Sitz Bath. Sitz Bath is a cornerstone of recovery from hemorrhoid surgery. It is more beneficial to lie down in a tub rather than just place the bum in a smaller circumference. And the reason is that when the pelvis is immersed in water, it relaxes the spasm more effectively, and it takes pressure off the anal area when one is laying down. In the first few days, there should be no additive. The temperature of the water is contentious, but warm water helps. 15 to 20 minutes is enough, and it is very helpful to be able to do this after every bowel motion, and other than that, about 3 times a day. And as I said before, this helps in relieving the spasm, this intense pain because of involuntary contraction of the muscles, both which are voluntary and involuntary muscles, and the pelvic muscles. What is the advice on activity, such as driving? Patients can return to driving provided that they have not had opioids for at least 24 hours and that their pain is well controlled. It is best to avoid strenuous sport and physical activity for the first 1 to 2 weeks, and the limitation again is mainly pain. Return to normal diet is encouraged after the first 2 to 3 days with the help of laxatives, and it is helpful to continue the laxatives for up to 4 weeks, specifically the stool softeners, and the diet is not excessive in constituents that will cause constipation or promote constipation. Now let's review some of the dangerous postoperative symptoms that ought to be reported to your healthcare provider. The first one is bleeding. Any excessive bleeding in the recovery phase ought to be reported immediately, and if excessive, patients must make their way to the nearest hospital. Inability to control pain should prompt a very early discussion with your healthcare provider and change of strategy. If there is spreading redness and fever, or fever on its own may be indicative of an infection. If patients have not opened their bowels within a few days, then rarely fecal impaction occurs, requiring a general anesthetic to release the stool, which is a complication of recovery, and patients are best advised to avoid this horrendous complication where possible. Urinary retention is a known complication because of the spasm of the same muscles that cause all of the pain and misery, but this is an ever-present risk, more likely to happen in the older adults. This by no means is an exhaustive list, but just an indication. And if patients feel unwell, they are best reporting to their healthcare providers or to the hospitals. This completes this video. I hope you found it of value. If you have any comments, please do share.